Imagine, right, getting a diagnosis for something, uh, complex like tuberculous pleural effusion, TPE, just a few hours.
Yeah.
Simple blood test.
No.
No invasive procedures. None of those weeks of waiting.
Yeah.
That's the future. This study, it was published in Respiratory Research. That's what they were kind of hinting at, and that's what we're diving into.
Really interesting.
It's a deep dive into this.
Yeah, it does seem like science fiction.
It does.
But the results, they're really promising.
Yeah.
This research team, they were in China.
Right?
They used, have you heard of large language models?
LLMs.
LLMs, yeah. So they used those to analyze patient data and then make predictions, diagnostic predictions about TPE.
So for those who haven't encountered LLMs, think of it like ChatGPT,
Yes.
but like the super smart version.
Yeah.
Instead of writing poems, these are trained on medical data
Right.
to become like expert diagnosticians.
Mountains of data. It's
Yeah.
really fascinating how they can sift through all this information, identify patterns, connect the dots, maybe even better than humans can.
Yeah. So before we get too deep into the AI, let's break down TPE. For
Right.
those of us who don't wear the lab coats to work,
Right.
what is this condition? Why is it so difficult to diagnose?
So TPE is a complication of tuberculosis.
Okay.
Affects the lining of the lungs.
Got it.
Basically, fluid builds up between
so-
the lungs and the chest wall, and that causes all kinds of uncomfortable symptoms.
Yeah.
And traditionally, to diagnose this, you
Yeah.
have to do these invasive procedures like biopsies.
Oh, wow.
Painful, can take weeks to get results.
Weeks of waiting for a diagnosis.
Weeks.
I can't even imagine.
It's also stressful,
Yeah.
especially when you're dealing with something, serious.
Yeah, so that's a key reason why this study is so important.
Exactly.
So they wanted to see if an LLM could diagnose TPE using less invasive methods faster, right?
That's right.
So they looked at 163 patients
Okay.
with pleural effusion. That's the medical term for fluid buildup.
Yeah. Yes.
And compared the LLM's performance to traditional statistical methods and even the latest machine learning models.
That's right. It was like an AI Olympics.
Yeah, it really was.
Put it up against the best.
Against the best.
And we have.
What happened? What happened with the scores?
The LLM did really, really well.
Really?
Not only better than the traditional statistical methods,
Why?
but it also did just as well as the most sophisticated machine learning models,
No kidding.
which are already doing amazing things in healthcare.
That's incredible.
Yeah.
But I'm curious, what does it mean performed well? Like, what were they actually measuring?
So they looked at two things, two key metrics: sensitivity and specificity.
Okay.
Sensitivity means how good the LLM at correctly identifying the patients that do have TPE.
Okay.
Specificity is how good it is at ruling out the ones that don't.
Ah, got it. So it's not just about being right. It's also about, like, avoiding false alarms.
No.
Which could lead to, like, more stress, unnecessary procedures.
Exactly, yeah. False negative,
Yeah.
meaning you miss a TPE diagnosis.
Right.
Could be really bad.
Yeah.
False positive, anxiety interventions.
Right.
This LLM showed impressive accuracy on both.
That's a huge win
Huge win.
for patients, doctors, everybody.
Sorry for him.
What really struck me was the LLM's ability to pinpoint specific markers in the blood
Yeah.
that are crucial for diagnosing TPE.
Right.
It's like the AI is not just giving a diagnosis, it's explaining its reasoning,
It's thinking, right?
Yeah.
It zeroed in on three things: ADA levels, total protein, and monocyte percentage. It's like a medical detector. Right.
It is.
Pointing out the clues.
Yeah, so it's not just a black box spitting out an answer.
No.
It's providing, like, valuable insights that doctors can use.
To understand the condition better.
Yeah.
Precisely. And to take it even further, they actually developed a user-friendly tool.
Oh, wow.
It's called TP. Okay. It incorporates ChatGPT-4,
Okay.
which is another really powerful LLM
Wow.
to make TPE diagnosis more accessible.
So they're putting this cutting-edge tech into the hands of clinicians.
That's right.
That's amazing. They're not just doing research, they're actually applying it.
Exactly.
That's really impressive. But before we get too far ahead of ourselves, why should our listeners care?
That's a great question.
Even those who, aren't in healthcare.
Right. If you think about the bigger picture, this research is a powerful example of how AI can really change healthcare for the better.
Yeah.
Imagine a future, faster diagnosis, more accurate, less reliant on invasive procedures.
That benefits everyone.
Everyone.
It's not just about treating illnesses. It's about catching them early
Yeah.
when, interventions can be the most effective.
Absolutely. This research, this is just the beginning.
Yeah.
If it can do this with TPE,
Right.
think about the possibilities for other diseases.
Wow.
It's exciting.
It is. It is.
The future of medicine.
Yeah. Okay, so we've established this LLM's really impressive.
Yeah.
But I'm curious about the process.
Okay.
How do you train an AI to be such a good diagnostician?
Right.
It's not like they just gave it a textbook.
No. It's much more nuanced than that.
Yeah.
They were really methodical about the data.
Okay.
Think of it like you wouldn't ask a detective to solve a case
Right.
with just random objects. You got to give them the clues.
Right. So you focus the LLM's attention
Exactly.
on the important information.
Yes. Give it a magnifying glass, not the whole library.
Right. Exactly.
So they started with over 600 potential data points,
Wow.
and they narrowed it down step by step
Okay.
to the 12 most informative variables for diagnosing TPE.
So it's like they gave the LLM a cheat sheet.
Kinda, yeah.
Highlight the key things to look for.
Exactly.
So how did they actually train it using this data?
Okay, so how did they actually train it using this data?
Okay, so they split the 163 patients
Okay.
into two groups, training set and a test set.
And they used the training set to teach the LLM the patterns,
Okay.
the relationships between those 12 variables, and a TPE diagnosis.
Okay.
So like showing it flashcards, right?
Yeah, yeah.
This one has TPE, this one doesn't.
Right, like a crash course in TPE diagnosis.
Yes, exactly.
Learn to recognize all the signs.
The subtle signs, yeah.
Okay. And then once it learned from that training set,
Then they tested it
okay,
with the test set,
Right.
which were patients it had never seen before.
it's like the final exam
The final exam.
after a semester of studying.
Exactly.
Did it pass?
It did.
Wow.
It diagnosed TPE accurately.
In patients it had never seen.
Never seen before.
That's wild.
Yeah, showing it could generalize to new cases.
Okay, but remember how we talked about, like, the LLM going head-to-head with other diagnostic methods?
Yes.
It wasn't just, the old school techniques.
Wow.
They put it up against the state of the art.
The best of the best.
Machine learning.
Machine learning, uh-huh.
So it was like LLM versus the reigning champion of machine learning.
Who won?
Well, it was really interesting. The LLM did just as well
Really?
as these highly sophisticated machine learning algorithms
Wow.
in terms of accuracy.
Huh.
So this suggests that LLMs can be just as powerful.
That's a bold statement.
It is.
I think some people might be hesitant
I understand.
to hand over medical decisions to machines, you know what I mean?
Of course, of course.
Where do the doctors fit into this picture?
Right. Well, it's important to say this is still early.
Yeah.
We're not talking about replacing doctors. We're
Yeah.
talking about giving them new tools.
Right, so it's more about collaboration
Collaboration, yeah.
with AI assisting doctors.
Assisting, that's the key word.
Making faster, more informed decisions.
Imagine the doctor has access to, the insights of an LLM
Right,
based on tons of data
yeah.
that could help them identify things they might miss,
It's like having a second opinion.
like a super smart colleague.
But one that can analyze information really fast.
Right. That makes sense. Leveraging the strengths of both
Both AI and human expertise.
to improve patient care.
That's the goal.
But they didn't just stop at the LLM. They made a tool to make it more accessible.
Yes, the TP package, remember?
Oh, yeah. Right.
That's a great example of turning research into something practical.
Yeah.
It's basically a user-friendly interface
Okay.
that lets doctors actually use this LLM
Wow.
for TPE diagnosis.
So they made it plug and play for doctors.
Exactly.
That's a huge step
It is. It really
towards
will.
making this, a reality in hospitals.
That's right.
This could really streamline the process.
Streamline, faster treatment,
Better outcomes.
better outcomes, yeah.
But of course, there are challenges.
Well, always challenges, especially in healthcare.
Yeah. What are some of the hurdles?
Well, one of the biggest is we need larger data sets
Okay.
to train these LLMs. Remember, the study was 163 patients,
Right.
one hospital in China. To really make sure these AI systems are effective
Right.
and unbiased,
Right.
we need data from a lot more patients.
To make sure that LLM is exposed to all different kinds of people.
All kinds of people, that's right. Different ages, ethnicities,
Persons.
different health backgrounds. Yeah, we got to make sure it can accurately diagnose TPE
Yeah.
and other conditions for everyone.
It's a reminder that AI is only as good as the data.
Exactly. The data it learns from.
Right. And I imagine there are also concerns about privacy,
Privacy is huge.
security,
Yeah,
when you're dealing with sensitive medical info.
absolutely. We have to prioritize patient privacy.
Right.
Make sure that data is handled responsibly, ethically.
Yeah.
That means things like anonymizing the data,
Right.
using encryption,
Right.
clear protocols for who can access it.
It's about building trust,
Trust, exactly.
making sure patients feel good.
Comfortable.
Yeah.
Knowing their information is safe.
And what about transparency?
Transparency is key.
How do we know? How do we ensure these AI systems are understandable?
Yeah, it's not enough for the AI to just give us an answer.
Right.
You need to know how it got there.
Right.
And there's actually a lot of research right now
Oh, cool.
focused on making AI more transparent, more interpretable.
So doctors and patients can understand.
Exactly. It's about making sure that AI is a tool that empowers,
Not mystified.
not a black box. Right.
Right, but this conversation has really opened my eyes to the possibilities.
Me too.
If LLMs can do this with TPE diagnosis, what else can they do?
It's an exciting time to be in medicine.
It is.
We're really just at the beginning.
Yeah.
We could see LLMs being used to.
Yeah, it really feels like we're on the edge of like a big change in healthcare with AI playing a bigger and bigger role.
Yeah.
It really makes you wonder how role of doctors,
Yeah.
other healthcare professionals, how that might change.
That's the big question, isn't it? I
Yeah.
mean, we've seen technology disrupt so many other fields.
Yeah.
It's only natural to think about what's going to happen with medicine.
Yeah, will doctors be more like AI collaborators?
Maybe.
Interpreting what the LLMs are saying,
Right.
then figuring out what to do.
Yeah. Could be a future where medicine is way more data-driven.
Yeah.
AI plays a key role in everything.
Diagnosis.
Diagnosis,
Yeah.
treatment, even predicting how patients are going to do.
Wow.
But it's not just doctors, right?
Right.
Nurses, technicians, pharmacists, everyone.
Right. How will their jobs change?
Except
Will there be new jobs?
maybe like AI specialist
Oh, interesting.
working alongside the doctors and nurses.
Bridging the gap
Yeah, bridging that gap.
between the tech and the patient care.
It's fascinating to think about the healthcare team of the future, you know?
Totally.
But you know what? This shift,
Right.
it might free up human healthcare providers to focus on the things they're really good at.
Like what?
Building relationships with patients.
That human connection.
Yeah, that human connection, providing support.
Yeah.
Dealing with the emotional side of things.
Which is so important.
so important.
It's all about finding that right balance, right?
It's balance.
Where
Yeah,
AI helps.
enhances.
Yeah, but doesn't replace.
Exactly.
AI can look at tons of data, spot patterns,
Right.
but it's the human touch, that empathy,
The empathy.
that makes healthcare really work.
I think that's a really good point.
Yeah.
You know, this research on TPE diagnosis, it really shows us what AI could do.
The potential
Yeah, but it's up to us.
to make sure it's used the right way.
Absolutely. It should empower both patients and healthcare providers.
Well, we've covered a lot today,
We have
from TPE to, the big picture of AI.
the future.
It's a lot to think about.
It is. It's been great talking with you.
Likewise, and as always, we've got to leave our listeners with something to ponder.
Okay, shoot.
So if AI can diagnose something complex like TPE with just a blood test,
Right.
what other medical mysteries could it solve?
Oh, that's a good one.
What diseases could become treatable, preventable even, with these new tools?
I mean, the future of healthcare is happening now.
It is.
It's amazing to see.
So stay curious, keep exploring, and join us next time for another deep dive.
Into the world of cutting-edge science and technology.
Until then, keep asking those questions, keep pushing those boundaries.
Absolutely. See you next time.